So interoperability has been a significant challenge really for decades. And having been in healthcare for a long period of time, I remember 30 years ago writing articles about interoperability and how essential it was to drive cost and quality inside healthcare. And unfortunately, even only a couple of years ago, I could have recycled some of those blogs and those articles and republished them, and no one would have known that they were written 25 years later. But within the last handful of years, what we've seen is, I think, a dramatic shift in the ability for both the industry to achieve interoperability as well as for the expectations of the market to achieve it. And there's a couple of things that help drive that, right? So first, right, is HHS's announcement yesterday and the rules that they have promulgated relative to moving interoperability forward. Now that's a really, really essential role that the government can play to level the playing field and set consistent expectations around interoperability, right? That in itself won't be enough, right? And the focus of HHS in these new rules is predominantly around payment. It's predominantly talking about payers, and that's very important because what consumers pay for healthcare today, right, is such a huge and crushing problem for them. But ultimately, when we talk about healthcare and improving cost and quality, safety and efficient use of those resources, what we have to do is we have to get at the clinical side of the house for interoperability, not the payment side. Historically, when we think about this, right, the federal government supported the movement to EHRs in order to digitize medical records to promote interoperability. But again, that focus of most EHRs historically has been, how do I manage reimbursement and payment? That is not a terrific source for clinical change. And so this next step forward with HHS is a positive, tremendous step forward, but it's not enough, right? We have to really move to the clinical side of the house for interoperability, and that's where this industry, right, starts to step in by the technical advancements we've been making. And there's huge momentum behind that, especially in the last few years when you start to see major companies investing in new technology and artificial intelligence to really, again, drive improvements in cost and quality. That kind of technology itself and the way it accelerates learning in healthcare with the new machine learning and statistical models here opens up brand new possibilities to add value and is creating new motivation in the industry in order to be more interoperable, because you have to bring data together in order for those solutions. But thirdly, what I think in the long run actually is going to make the difference, and I suspect is going to be more than just the tipping point factor here, is going to be consumers, patients, and their demand. Consumers are incredibly used to now, in all aspects of their life other than healthcare, have access to data immediately. And again, that's whether it's on their watch, it's whether it's on their phone, it's completely and readily available in ways that's meaningful and useful. But healthcare isn't. Tragically, it's not. I can't open my phone and today get information on the 5 different doctors that I received care and treatment in 4 different places, the 3 pharmacists I got, medication from in the last 2 years, etc. It's just not available there. But it will be, because now we're starting to see initiatives by companies in Silicon Valley, companies outside of healthcare that are working with us that are supporting patients. So you need the government to support some rational rules. You need the technology industry to continue to free data up, get away from the silly proprietary standards that get used into public standards, make those investments here, and consumers are going to drag us into it, I think, in the end.